When you retire early, most people think health insurance will destroy their budget. But here's the scary part for 2026. It could get much worse. The temporary laws that made health insurance cheap, those are expiring. The subsidy cliff is likely coming back. And that means $1 of extra income could cost you $20,000 in lost subsidies instantly. Two couples can have the exact same spending, lifestyle, net worth, and one pays $28,000 per year while the other pays only $4,000. Same plan, same coverage. The only difference, one of them knows how to dodge the 2026 cliff. I'm Josh, a partner at an award-winning retirement-focused firm. And today, I'm showing you the exact framework so your health insurance stays affordable, even if laws change, as long as you understand the one number the government actually cares about. So let's start with the big question. Why do some early retirees pay almost nothing for health insurance, while others are getting crushed? The answer, it comes down to one number most people have never heard of: modified adjusted gross income. That's MAGI. And here's the twist, that shocks everyone. Your health insurance premium has nothing to do with how much you spend. You could be living on $200,000 per year, traveling, dining out, living comfortably, and still pay almost nothing for health insurance. Because the Affordable Care Act doesn't care about your spending or net worth, it only cares about your MAGI. Think of MAGI as your taxable income on steroids. It includes withdrawals from traditional IRAs and 401ks, capital gains and dividends, interest income, Social Security, even pension income. But here's what it doesn't include: Roth IRA withdrawals, principal from taxable accounts, or cash from savings. This is the game changer. You can spend $135,000 per year and only report $60,000 in MAGI. Same lifestyle, completely different premium. But most retirees, they pull everything from their IRA because it's simple. And in 2026, that simplicity could cost them everything. If you want health insurance before Medicare to work in your favor, you need to understand what counts towards MAGI and what doesn't. Let me tell you about Mark and Linda. They're both 60, retired early with $1.3 million in pre-tax accounts, $450,000 in Roth, and $650,000 in taxable accounts in cash. They needed $135,000 per year to live. Before they work with us, they plan to withdraw the full $135,000 from their IRA. It was easy, simple, and only one account. But here's what that would cost them in 2026. Their MAGI would be $135,000. Now, under the expiring rules, they would have paid a capped percentage. But under the cliff, likely returning next year in 2026, they're over the limit. Zero subsidy, full price. Their premium, likely over $2,300 per month. That's nearly $28,000 per year. And over 5 years, $140,000 in health insurance costs. They assumed that this was just the price of early retirement. But then we fully redesigned their withdrawal strategy, like a full tear-down home remodel. $35,000 from their IRA, which counts towards MAGI, $50,000 in principal from taxable accounts, that does not count, $25,000 from Roth, that does not count, and $25,000 in capital gains, that does count towards MAGI. So their total spending, still $135,000, but their new MAGI, only $60,000. That new silver plan premium, likely around $490 per month. That is roughly $5,800 per year. So savings are over $22,000 per year. Over 5 years, that's over $110,000 saved. Same spending, same lifestyle, just a different withdrawal sequencing. Now here's where most early retirees are going to get hurt in 2026. For the last few years, subsidies worked like a sliding scale. If you made a lot of money, you just paid a little more. Not a big deal. But assuming Congress lets the temporary enhancements expire, that cliff is back. The cliff is a hard line in the sand at 400% of the federal poverty level. For a married couple in 2026, that line is approximately $84,000. So if your MAGI is $83,000, you get thousands in tax credits. If your MAGI is $85,000, you get zero. And here's the brutal part. There is no partial credit. You don't get a letter warning you. you just file your taxes and realize you owe the IRS $15,000 or $20,000 because you disqualified yourself. I've seen retirees accidentally drift into this zero subsidy zone simply because they sold a stock at the wrong time or pulled too much from an IRA. This is why precision matters. You need to calculate your projected MAGI down to the exact dollar. If you're in the safe zone, you pay almost nothing. Drift just $1 too high, you're voluntarily paying the full retail price, wasting thousands of dollars you did not have to spend. And you know what? This still isn't even the worst part. The years between retiring and Medicare are the prime time to control your income. This is the retirement gap window. And if you use it strategically, you can save hundreds of thousands of dollars. Here's why this window is powerful. No W-2 income, no Social Security, no Medicare IRMA surcharges. You have total control over your income. During this window, you can keep MAGI low to stay under the cliff, do strategic Roth conversions in low tax years, carefully of course, harvest capital gains at 0%, and delay Social Security to maximize your lifetime benefits. But here's what I see constantly. Retirees claim Social Security at 62 because they're nervous. Now they've just added $30,000 to $40,000 to their MAGI, and that's permanent. This pushes them dangerously close, or maybe even over, that $84,000 cliff we talked about. Health insurance, the costs skyrocket, and they can't undo it. Or they pull everything from their IRA without thinking. They spike their MAGI unnecessarily, and they lose years of potential subsidies. The smartest retirees do the opposite. Delay Social Security as long as possible. Blend withdrawals strategically. Use the gap window to keep MAGI low while still living comfortably. And then by doing this, they save tens of thousands every single year. There are 3 mistakes that can completely destroy this strategy, especially with the cliff returning. Mistake number 1, all your assets are in a pre-tax account. If everything's in a traditional IRA or 401k, you're stuck. Every dollar you withdraw counts toward MAGI. No flexibility, nothing to blend. This is why tax diversification matters before you retire. You need money in different buckets. That's pre-tax, Roth, taxable, even cash. Because if you're 5 or 10 years from early retirement, you're going to want to start building that cash now, that taxable bucket now. Do Roth conversions during low income years. Because if you retire with $2 million entirely in a traditional IRA, you'll almost certainly be forced over the cliff and pay full price. Mistake number 2, claiming Social Security too early. You retire at 58, you're nervous about spending your portfolio, and Social Security at 62, I get it, that feels safe. But every dollar of Social Security counts towards MAGI. So claim $25,000 per year at age 62. Well, you've added $25,000 to your MAGI every year going forward. That takes up nearly 30% of your safe zone budget before you even withdraw a dime for spending. Now you're spending $20,000 more per year for health insurance, and you lock in a 30% reduced Social Security benefit. Better strategy, use your portfolio to bridge the gap. Delay Social Security until 65, 67, even 70. Keep MAGI low during the retirement gap, maximize ACA subsidies, and then you can claim Social Security for a much higher benefit. Mistake number 3, assuming all states and plans work the same. Health insurance for early retirees doesn't work the same everywhere. Some states expanded Medicaid, others didn't. Some have robust marketplace plans, others, they have limited options. So your zip code, it affects your premium as much as MAGI does. I've had clients move from California to Nevada and save $500 per month. Same metal tier, similar coverage, but a different cost because each state has its own marketplace. So before you retire, research your state's marketplace. Know the subsidy thresholds. And if you're already considering relocating, factor health insurance costs into your decision. Here's your 3-step framework. Step 1 is to map your account types. List how much you have in pre-tax, Roth, and after-tax. This tells you if MAGI control is even possible, because if you're 90% pre-tax, you'll want to start building tax diversification now. Step 2, design your withdrawal blend. Put your creative hat on. Decide how much to pull from each bucket. The goal, keep total spending high, but MAGI safely under the 400% FPL, which is approximately $84,000 for a couple. Here's an example. $120,000 per year. Let's go $40,000 from an IRA, that does count towards MAGI. $40,000 principal from taxable, does not count. $30,000 from Roth, does not count. $10,000 in capital gains, that one does count. So your total spending, $120,000. Total MAGI, only $50,000. You're safely under the cliff, and that's a huge subsidy locked in. Step 3, calculate your projected MAGI and subsidy level. You can use a tool like the Kaiser Family Foundation ACA calculator. Make sure it's updated for 2026. Plug in your age, zip code, household size, and planned MAGI. This will show you just about your exact premium. If you're over the cliff, adjust your withdrawal blend immediately. Pull less from pre-tax, more from taxable or cash. Rerun until you're in that safety zone. Early retirement health insurance doesn't have to kill your budget. Understand MAGI, blend withdrawals, stay under the cliff, and you can legally slash your premiums. Mark and Linda saved over $100,000 over 5 years compared to the full price plan. Same spending, same lifestyle, smarter withdrawal sequencing. I've seen this work for hundreds of clients, but it requires careful planning. Map your accounts, design your withdrawals, and calculate MAGI before you retire. Once you're in retirement, it's much harder to fix. So if you're 5 years out, start building tax diversification now. And if you're already retired, run your numbers for 2026 today. If you're paying full price for ACA coverage, ask yourself, do I really need to? Now, if you prefer to hand all this off to a professional, there's a link in the description to learn more about my team. This is exactly what I do for a living. We talked briefly about Roth conversions today, so check out this next video to learn what it is and, maybe more importantly, the mistakes that are completely avoidable. Like, subscribe, and I'll see you there. Thank you for watching.